from CBS 2 News, this is a special report.
Mayor de Blasio is giving an update on the coronavirus pandemic in New York City. Let's listen in.
Yesterday, all over the city in large numbers, out there protecting people's lives by making sure there were no large gatherings, by making sure that social distancing was being enforced. I am so appreciative for everyone who is out there from all those agencies who are giving out face coverings, and I know people really appreciated that. A great effort yesterday, and only a beginning, because as more and more members of the NYPD are coming back on the job, some of whom, of course, were sick, some of whom are still fighting against this disease or even in the hospital, and our thoughts, our prayers are with all of them, all the people who work for this city on behalf of you who are still fighting this disease. Our hearts and prayers are with all of them, all of you, all of your families. But what I am so proud of yesterday was a strong effort across the whole city by the NYPD, the Parks Department, all these agencies to make sure that these rules are being enforced, to make sure people had what they needed. And this is just the beginning. More will come as we get more and more personnel back, and we're going to deepen these efforts. There are going to be more and more efforts to give out those face coverings, more and more efforts to educate people, but as I've made very, very clear, and Commissioner Shea has made very clear, more and more enforcement efforts as well in every single part of the city. Now, I have to put that in context. We, of course, need enforcement. It's part of life. But the big story here is what New Yorkers have done right. There's always going to be exceptions. There's always going to be some people who don't get the message or are thinking about themselves and not other people. But the vast majority of New Yorkers have really risen to the challenge powerfully. I want to thank you. It's been amazing to watch how carefully the vast majority of you are going about social distancing, how many people are already wearing face coverings. Not perfect yet, but by the way, this is something we would never have imagined just a few weeks ago. But when you go out there, you see, and I've been in neighborhoods all over the city in the last week or two, noticing that the vast majority of people are wearing face coverings, and we're going to make that easier and easier. But people are doing it right overwhelmingly. We need people to stick with it. We need anyone who hasn't gotten the memo to get the memo, because that's the only way we're going to get through this. But New Yorkers, you have a lot to be proud of, and that's the big story here. Now, it's important to always remember the direct connection between what you do and what happens to the whole city and what happens to our future. Comes back to those indicators we go over each day. Now, on Friday, I talked about what we had seen over the last few weeks, and it's overwhelmingly good news. We know we're not out of the woods yet, but it's good news for sure. But today I want to focus on the challenge. Well, today I want you to understand that when I talk about the danger of this disease reasserting, it's not an idle idea. It's not an idea somewhere someone just thought about, but it's never happened. It's an idea that unfortunately comes from the real life experience that we've seen in other parts of the world, this danger that if you let your guard down, the disease can reassert and set back everything. So when New Yorkers think about the question I hear so often from people, how do we get back to normal? I want you to think about it is every one of us that gets us back to normal. It's your responsibility, it's my responsibility, it's all of our responsibility to get back to normal. We all play a role in this effort. And when you think about what would it mean if we didn't do it right, what should we be afraid of? What should motivate us, not just because we want to do the right thing and we want to get back to normal, what should be motivating us to be aware of, to be worried about, that will keep us on the mission, keep us focused? I'm going to come back to that ugly word, that dirty word I mentioned the other day, boomerang. That's the word I want you to think about when you think about what could go wrong. I've told you a lot about what's gone right. But I want you to look at that image of the boomerang, get it in your mind, and think about that's the thing you do not want. We cannot afford a boomerang with this disease in this city. Now, it's a ferocious disease. I think we've all established, we all have seen painfully, so many of us have experienced in our own families and our own lives why it's such a dangerous disease. And this is not a disease that'll just walk away and leave us alone and go quietly into the night. No, we're going to have to fight it back if we want to rid ourselves of it. Look, the danger is a bounce back, a boomerang, where the disease seems to be going away and then reasserts, and the cases come on more and more, and the numbers go up, and more people are afflicted. And that would set back a restart and a recovery by a long time. And I'll give you real examples to show you what's happened in some other places where that's exactly the problem they had. They jumped too soon in various ways, and then their restart and recovery took a lot longer. So now the question I'm sure you will ask yourself is, well, what can I do to make sure we don't have that boomerang, to make sure we don't have that happen here? And the answer is that we need to stick with what's working. We need to understand that the restrictions in place are working, and that they only get relaxed carefully and slowly. There's no on-off switch here. It's not like you have all the restrictions one day and the next day you're back to normal. I don't think people even expect that anymore. I think people understand we'll be fighting this disease in different ways for quite a while. Doesn't mean we can't start to get more normal, but it means job one is to beat back the disease. So since it's not on-off, we would do things in careful stages and make sure that each step we take is working before we take the next step. We have to do this to protect our people. We have to do this to make sure our hospitals are not overwhelmed and they can be there to save our lives. We have to do this so we can restart and recover. Now, I told you when I talked to you about this image, and I now hope it's really in your mind, the boomerang. It's not an abstraction because it's actually happened in other parts of the world. I want to give you those examples. So the place to look is to Asia, because they have been through many experiences that prepared them for the coronavirus. Many parts of Asia went through SARS and the bird flu and different challenges. And we can learn from their experiences. It helps us to understand our future and how we can get it right and what not to do as well. So many parts of Asia have done smart strategies, but they also have made those missteps at times that are instructive to all of us. And the smallest misstep, the smallest weakness is exploited by this disease. So I'm going to give you 3 examples of a boomerang, and we can learn from each one. First, let's go to Japan, and the lesson of Japan is don't come back too early. This is a raging discussion in our own country right now as some states are rushing to restart. And it looks to me like some of them are doing it without a lot of evidence, without a lot of healthcare indicators to tell them what's really going on. And I'm hoping and praying for them that doesn't backfire horribly on the people of those states. In Japan, there is the example of the region of Hokkaido. And it was a region that had initially experience with the coronavirus. And then late in February, after having only about 70 cases, this region declared a state of emergency. For 3 weeks, there was a lockdown in Hokkaido. And again, I emphasize just 3 weeks, at which point it seemed like the disease had been contained. Now, we all know 3 weeks is not a long time. So after 3 weeks, the lockdown was lifted on March 19th, and it wasn't lifted gradually, it was lifted rather abruptly. So schools were reopened, public gatherings were allowed again. There were still some restrictions, but some of the biggest indicators, if you will, some of the places where people get together the most, like our schools and public gatherings, those were the places that somehow were allowed again almost instantly. 26 days later, there was a surge in cases again in Hokkaido. And guess what they had to do, very sadly? They had to go right back to stringent restrictions, and that's what they're still experiencing now. So that's one case study of a place that thought they had it beat, didn't necessarily wait a long time to make that conclusion, and then went very fast back into a restart, and now, unfortunately, are paying for it. Now let's look to Hong Kong. Hong Kong is an example of how, even if things look better, small levels of activity can suddenly grow into something much worse. So by early March, it looked like Hong Kong was pretty much done with the disease and normal life resumed. Travelers started returning home to Hong Kong. People were allowed to go out again. Nightlife started again. Obviously, very, very active nightlife in Hong Kong, a city very much like New York City. Lots of bars, lots of restaurants, clubs. People went back out. And in late March, the cases started to surge. What happened? The government had to now, in Hong Kong, put a variety of new restrictions in place. Restricting travel, restricting gatherings, schools, all sorts of places people went. Those restrictions had to be asserted again, and then in April, even more had to be added. So again, an example of a city very much like ours that found they had to put back restrictions and then go even farther. The last thing we want to see here, again, our job is to have a clear, steady march forward, as steady as it can be. When the time comes to relax the restrictions, relax them and get it right once and for all, and never have that boomerang effect. One more example, Singapore. Now, Singapore has been lauded for doing a lot of things the right way early on in this crisis. By the middle of March, there were relatively few cases. Singapore was getting a lot of praise for a very strong, focused effort to address this disease. But again, not every part of the equation apparently was considered in Singapore. And one of the things that typifies Singapore is there's a number of migrant workers, and they live in dormitories. The dormitories were allowed to fill up. By late April, there were hundreds of new cases of the coronavirus. And the government had to impose a 2-week stay-at-home order, and now has even increased restrictions on schools and restaurants and other types of public gatherings. So, 3 case studies. What they have in common is they're all examples of the dangers that exist if the restart goes the wrong way, and if that boomerang effect is allowed to happen. And it's a reminder that we have to be vigilant, because even a small number of cases can lead to that resurgence if the right restrictions aren't in place. It's also a reminder that what we're building up, the massive testing apparatus and tracing apparatus and the ability to isolate people, quarantine people, that has to be stronger and stronger all the time to make sure we put the disease in check and keep it in check. So the bottom line is we have to get this right. Now, testing, as I said, testing is the key. Testing has always been the key. And I'm going to talk to you now about something exciting happening right here in this city to make sure that we will have what it takes for wide-scale testing. As of this week, we have begun the process of producing test kits here in New York City. And this is a first in our city's history, because this was not a place like so many other parts of America that thought we had to have our own medical supplies and medical equipment built right here. But we've learned a tough lesson that we have to create and we have to protect ourselves. That's why we're going to have a strategic reserve going forward for New York City to protect New York City. So for the first time, we are producing now test kits in New York City. And this has had to be put together very quickly. A lot of partners brought together, a lot of different moving parts that had to be made sense of. It's never been done before. So we're really in uncharted territory creating these test kits in New York City. And I will tell you, like so many other things we've been working on, there'll be moments when we have to figure things out. Sometimes there'll be times when we have to try something, even if it doesn't work, try something else until we get there, because we are in uncharted territory. But we are confident that we're making progress, and we're confident that we're going to have test kit production in this city that's going to be a key part of what we do going forward. Now, at one point, I talked about a test kit, and I use an analogy to a cup of coffee. If you want a cup of coffee with milk and sugar, you need a cup, you need water, you need coffee, beans, you need sugar, you need cream. You need all the things that allow you to make a cup of coffee the way you want it. Well, a test kit has something in common with that. You need 3 parts for a test kit for the PCR test, the diagnostic test for the coronavirus. You need the swabs to take the actual sample. You need the transport medium, which is what keeps the sample in place on the way to the lab. And you need the screw top tubes to protect the sample from any contamination, so what the lab gets will be accurate. Well, the good news is these screw top tubes are something we have plenty of access to, but the 2 challenges were the swabs and the transport medium, the fluid that you actually keep the sample in. So the swabs, well, a painful, painful irony that the entire world experienced a shortage of these swabs starting over the last month. Why? Because almost all of them were made in northern Italy that turned out to be one of the epicenters of the global crisis. We realized we had to find another source. The global market wasn't working. There weren't sources around this country that were reliable enough, so we decided we would make our own. And this small piece of plastic here, it's long. I want to remind you that the way this works is it is put literally by a medical professional well up your nose. So it is a very careful effort that has to be done by someone who knows what they're doing. But this seemingly simple piece of plastic actually proved to be a complex matter because it has to be done just the right way. And it has to be kept sterile in packaging like this until the point when it's actually used on a patient. So getting this right proved to be actually a complex matter. But again, there's tremendous talent in this city. And so many people, so many companies, so many partners who came forward and said, we want to get this done because we know it'll save lives in our city. So our local partner is Print Parts, a 3D printing company. And they are using designs like this one that have been clinically validated. In this case, we found a partner in the Beth Israel Deaconess Medical Center in Boston, and another partner in Envision Tech, which is a medical 3D printing firm. So we put together a coalition of different organizations to help us get this right. Now, how many? When? Well, 30,000 will be delivered by this Friday, and then we'll be on a track thereafter for 50,000 a week. Now, I mentioned what's called the transport medium. This is the fluid that the samples are kept in. Our local partner is the Albert Einstein College of Medicine, a great New York City institution. They worked with what you might call a recipe, which is, follows a CDC-approved protocol. And the first batch of this transport medium will be produced this week in New York City. Still has to go through a validation process, so that's going to take a little more time. But by the week of May 17th, we will begin to pair the locally made swabs with the locally made transport medium. And then, like that cup of coffee, we'll have all the pieces come together, and for the first time in the city's history, we will have our own test kits produced in large numbers right here in the 5 boroughs. In the meantime, we're not going to wait. That initial set of 30,000 swabs that will be delivered by Friday, we will pair with an interim source of transport medium from outside New York City. And that pairing will happen Friday, May 8th. Those full test kits will be delivered wherever they're needed to be part of our widespread testing effort by the week of May 10th. So this is all growing all the time. And more pieces are going to be brought into play so that we can get to that widespread testing to help us go on the offensive, testing, tracing, isolating, quarantine, all the pieces needed to fight back this disease and avoid that dreaded boomerang. Now, we've talked about testing from the beginning. First time I asked the federal government to help us get testing was on January 24th. That request, that plea was ignored. We still are waiting for the federal government to help us. Now we need their help with lab capacity. We're still not getting the help we need, and we're going to keep fighting for it. But I want to take a moment to appreciate the people who work in those labs. You know, we've been rightfully talking about our healthcare heroes, our doctors, our nurses, all the healthcare workers, our first responders, our essential workers, the folks in the grocery stores and supermarkets and pharmacies, all the people out there doing such important work. But let's talk about the people who actually help us know if someone has this disease or not, the lab techs. Let's talk about them. All the people who work in the labs, we depend on them, and they are unsung heroes too. And I want to thank everyone, of course, who works in the private labs, because we're depending on them. But I want to highlight those who work in our public labs. And I want to say, give credit where credit is due. I was on Friday evening, you know, of course, the 7 p.m. clapping for all the healthcare heroes. I went to Interfaith Hospital in Brooklyn, a wonderful institution. Earlier in this decade, a lot of us in Brooklyn fought to protect Interfaith Hospital from closing. Thank God we all did work with the community, and the community stood up strong to protect Interfaith. And Interfaith's been front and center in this crisis. I talked to some of the folks who work at Interfaith, some of whom I knew from that first fight to keep it open. And we were talking about everything that had happened there. And a couple of people from the lab came forward and they said, hey, don't forget about us. Don't forget about the lab workers. So to all the lab workers, first of all, in all the 56 hospitals of New York City that have been a part of this fight, all the lab workers in all the private labs, all of you are also heroes in this effort. I want to express my deep thanks to all of you, but I want to especially thank those who've worked in our public labs. So first of all, at the New York City Department of Health, the Public Health Lab, you've heard more and more about it. It's been a crucial part of this equation. More than 200 staff work there, and for the last 2 months, they have literally been working 24/7. It's been a big part of how we fight back to have the Public Health Lab, nonstop getting results for New Yorkers who need them. I want to thank Dr. Jennifer Rakeman, the Assistant Commissioner, Department of Health, and the Director of the lab and her entire team. Job well done. And at Health and Hospitals, our public hospital and clinic system, more than 1,000 lab professionals have been in the forefront. Our public hospitals have been the front line of this crisis. I want to thank the technologists, the technicians, the pathologists, everyone who's part of those H&H labs. You've been amazing. You've worked nonstop. You've been strong and focused, and it's helped us to make the progress we've made with this disease so far. Special thanks to Kenra Ford, the Senior Assistant Vice President of Lab Services, and her entire team. Thank you so much. So remember, when you're thinking of all the reasons to be thankful to be a New Yorker right now, think of all the heroes we thank every day, but think of some of the heroes we may not think about as much. Think about those lab workers. You only get the answer to the test because of them. And we only find the ways that we can fight back this disease because of the information they give us, and they never stop. They work round the clock. So thank you to all the great people who work in the labs. Now, we're going to beat back this disease. We're going to do it with testing, tracing, isolating, quarantining, all these strategies that work. We're going to do it on a vast scale, but in the meantime, we continue to fight that other part of the crisis, that horrible reality of people who've lost their livelihood, struggling to make ends meet, in so many cases struggling just to get food on the table. Remember, the estimates before the coronavirus were about 1.2 million New Yorkers, and this is a very sad reality. 1.2 million New Yorkers experience some amount of food insecurity at any given point in the year, and that's a horrible number to begin with, and something we've been trying to fight back for years. Now that number, even though we don't have all the facts yet, and we're still trying to understand the sheer impact of this horrible crisis on everyday New Yorkers, that number may have grown by 1 million. There could be as many as 2 million or more New Yorkers experiencing food insecurity now, or who will be experiencing it in the coming weeks. So we have to help people right now. And from the beginning, I've been painfully aware there's a lot of New Yorkers who now have to ask a question they never thought they'd ask, and that question is, where's my next meal coming from? And the answer from the city of New York, the answer from your city government is, we will be there for you. No New Yorker will go hungry. No matter what it takes, we will provide food to everyone who needs it. So food delivery is a big piece of this, because there are a lot of people who can't get out. They're seniors, they're vulnerable folks, there may be people with disabilities, whatever it is, there's reasons why they can't get out, can't get to food, particularly in this tough environment. There are a lot of people who used to depend on other people to bring food for them who can't right now, or depended on members of their family who were the breadwinners who don't have an income right now. So we made it our business to do a massive food delivery effort for those who are most vulnerable. And again, I want to emphasize, a lot of people who need food right now are people who just weeks ago considered themselves solidly middle class or working class. Everything was, if not fully under control in their life, certainly something like where your meals were coming from was under control. A lot of people have felt a horrible disruption in their lives, and we have to make sure each and every one of them know, no matter what you go through, we're going to be there for you. There is no shame in asking for the help you need, and we want to make it as easy as possible for you and your family. Currently, we are at capacity where we can deliver as many as 3.1 million meals per week. Our goal is to keep ramping that up as high as we need it to be. If needed, we can take that capacity as high as 1 million meals per day. A staggering number, but we can do that if that's what we need to do to keep people safe and to keep them fed here in New York City. So we continue to expand our Get Food program, and particularly our delivery program. But to do this, to keep expanding, we're going to need help at the community level. So I'm going to today be asking people to join in who can help us in this endeavor. We need more personnel at the distribution sites. So if you're a nonprofit organization, a community-based organization, there are a lot of great ways we can partner with you. First of all, we need to immediately find an additional 300 staff members who can manage distribution sites. So we're looking for nonprofit partners with that skill, that ability to manage a site. We need you to come forward right away. We need help actually preparing meals. Look, we are now at a point when I'm talking about going as high as 1 million meals a day, where all of the places we're preparing the meals are getting maxed out. So we need commercial kitchen capacity. And this is an opportunity to work with a number of nonprofits and businesses that currently don't have the ability to operate normally. We want to bring you back into play as part of this very noble effort to feed your fellow New Yorkers. We would love to get people who represent all the communities of this city. So we're interested in any organizations that can help us, particularly feeding folks with some of the foods they're more used to. In the East Asian community, South Asian community, Caribbean community, that will help. We're going to make sure people are fed. If we can help people to have some of the foods they're familiar with in the process, that's even better. And we need help with delivery. in specific neighborhoods where we need more personnel and in sourcing available meals in those neighborhoods. The more we can do locally, the better off we'll be. Having the kitchen capacity, having the delivery all happen locally, the more local, obviously, the less traveling around, the more efficient, the speedier, the better. So I'm going to name some neighborhoods where we are particularly looking for help. We're looking for help in Melrose, in Washington Heights, in Howard Beach, South Ozone Park, in Gravesend, Sheepshead Bay, in Morris Park, on the North Shore of Staten Island, in Flushing, in Jackson Heights, in Eastchester, and in Sunset Park. And we're particularly looking for providers who can help us by producing at least 1,000 meals a day. We've put out a request. It's online right now. Anybody from a nonprofit organization or anybody who thinks they can help us with these immediate needs so we can really expand this meal program intensely, please go to nyc.gov/nonprofits, nyc.gov/nonprofits. Okay, a few more things. So, next Sunday, a very, very important day every year, Mother's Day. It is a day that we cherish in our family. It's a day when everyone remembers to express their deep appreciation to, in our case, the mothers in our life, but every family, remembering how much we owe the moms in our families. Now, this is not going to be a typical Mother's Day, to say the least, and unfortunately, we've gotten some practice here because so many other crucial days in our year from all different faiths, all different communities have overlapped with this horrible crisis. We went through Easter, Passover, now Ramadan. Everyone's trying to figure out how to maintain our traditions and everything that is so dear to us in the midst of this crisis. Well, we're going to have to improvise again for Mother's Day. Now, Mother's Day, for so many of us, means gathering together. In fact, it's a day when our moms expect everyone to come together, stop what you're doing, and just slow down and appreciate the family and appreciate the mom in your life. But to appreciate mom this year, it means keeping mom safe. It means doing things differently. And that's particularly true if your mom happens to be older. We want to protect all the moms of New York City. And the way to do that is to show love and appreciation in different ways. We used to all flock home to mom. This is not the year to do that. It is the year to show love and support in different ways. In fact, normally the gift we give to mom is to all show up. This time the gift we can give to mom is to give her some space and help her stay safe. So you can celebrate lots of other ways. FaceTime, Skype, Zoom. There's so many ways you can celebrate. You can also do that old-fashioned thing we call a phone call, which moms still appreciate very much. In fact, many moms are like, you could call more often. They'd like that. You can go outside mom's house and wave from the sidewalk. You can do all sorts of things. But let's remember how important social distancing is for everyone, and let's remember protecting mom's health should be the #1 thing we think about on Mother's Day. Our moms have brought us through everything, and the way we honor them is to remember what it's going to take to fight back this disease and bring them through safe and sound, and we can do that together. Now, want to talk to you something I talked about on Friday, and it's such a powerful, a tragic story, but also a powerful story of human devotion. I talked about a paramedic from Aurora, Colorado, Paul Carey, and we lost Paul. He came here to help us, and we lost him to the coronavirus. And amazing how small a world it is. So Aurora, Colorado is also where New York City's Emergency Management Commissioner, Deanne Criswell, comes from. And for years in her hometown, she served in the fire department, and she served with Paul Carey. And what a shocking coincidence that he ended up coming to New York City to help us in our hour of need. and then so painful that this disease has taken him. Well, first of all, my deepest thanks to the entire FDNY family, firefighters, the EMTs, the paramedics, everyone at the FDNY, and my deepest thanks to the NYPD. After Paul was lost, they gave him a tribute and treated him as one of our own. And a lot of you may have seen the images, but powerful, powerful respect shown by our first responders to one of their own who didn't come from here and was only here a short time, but gave to New York City so much. And all of our first responders honored him as if he had been a lifelong New Yorker. And I know the Carey family was deeply moved by that. I also want to thank the New York Daily News. Daily News put Paul on the cover yesterday, and very moving tribute to him. And, you know, the thing that goes on the cover of the newspaper sends such a powerful message. So to think that one of the most prominent newspapers in the country honored this man who came here of his own choice to protect us and serve us, that was a very beautiful tribute. So thank you to everyone at the Daily News for doing that. And thank you again to Paul's family, and we will remember him and we will memorialize him, but it's so important to remember this great example of heroism. Now, we have an example of heroism in Paul. We have an example of people doing the right thing every day in New York City. It has become something we are so proud of, to recognize how many people are just doing what's right to protect other people, to be compassionate for other people, to care about other people, to recognize the depth of this crisis and be there for their fellow New Yorker. That's what everyone should do, anybody, any everyday New Yorker, and especially anyone in a position of authority anywhere in this city, anywhere in this country, should feel in their hearts what New Yorkers have gone through and ask the question, what can I do to help, just like all our heroes do? Well, let me talk today, unfortunately, about someone who did the exact opposite of that, and I was shocked when I heard this. The White House economic advisor, Kevin Hassett. He says, there's talking about the stimulus program, talking about what's needed to get New York City and all cities and states back on their feet. Yesterday morning, he says, well, everything appears to be happening safely, and literally, this is a quote, he says, there is a chance that we won't really need another stimulus, a phase 4 stimulus. Listen to those words. There's a chance we won't need it. Well, let me tell you something, Kevin. Why don't you come to New York City? Why don't you go to Elmhurst Hospital? Why don't you talk to our first responders? Why don't you talk to the families who have lost their loved ones? Or go to the ICUs where hundreds of people are still fighting for their lives. In terms of your desire, which is pretty transparent, to save money rather than to protect people, to risk the future of New York City and this state and so many cities and states around the country, it is outrageous that anyone with a position of authority in our federal government could even breathe these words, because it's disrespectful in every way. It is an absolute misunderstanding of what has happened here and what continues to happen, and the fight we're still waging, and how much it's going to take to get back on our feet this year and next year and the years thereafter. I was disgusted when I heard these comments, because it sounded like the comments not only of a cheapskate, but someone who just didn't care. So I hope President Trump will renounce these comments immediately. I don't know why this guy is his economic advisor if he could say something like that. The president needs to speak up and say that's absolutely unacceptable. Right now, we know in the Congress, intense effort is going on to create a stimulus. Why? Because what's happening in cities and states all over the country right now, red states and blue states, red cities and blue cities, is mayors and governors, unfortunately, are having to cut back more and more, and it's soon going to really affect the basic services we all depend on. The kind of cuts we're talking about will lead painfully, horribly, to furloughs, to layoffs of public sector workers who are the backbone of our cities, our states, the people keep everything going, the people we need even more in a recovery. And here's the painful reality I want you to take in. Listen to these very dangerous comments from this White House official and then translate it into reality. If there is not a fourth stimulus, and if that stimulus does not amply provide for the needs of cities and states this year and next year, then the very people who've been our heroes, the very people who've been saving our lives, those doctors, those nurses, those firefighters, EMTs, paramedics, police officers, the people keeping this place going, the people keep it going all the time, the sanitation workers, the educators, all the people we are depending on for a restart and a recovery, their futures will be compromised. Imagine if the very same doctors and nurses working in our public hospitals, or the very same EMTs and paramedics who were such heroes in this crisis, imagine if, after fighting through this battle, months from now, they had to face furloughs or layoffs here and all over the country. If we don't get help from Washington, that is what will happen. And I'm talking about one place, one city right here already, $7.4 billion in the hole because of a crisis we didn't ask for and we didn't create. Came to us from another place. But all of you have fought heroically through it. I just want to see everyone in Washington show a little bit of respect for what New York City has gone through and so many cities and states around the country have gone through, and just do the right thing and help us back on our feet. Okay, we're going to go over the daily indicators. And as I've said, the reality of these indicators is what's going to determine our future and directly relates to all you do. We've generally seen progress, not quite enough yet. We have to keep at it. So today, progress generally, still more to go. First indicator, daily number of people admitted to hospitals for suspected COVID-19, that's up, and that one troubles me, but it is the truth, up from 92 to 113. But the other indicators are down. Daily number of people in ICUs across our public hospitals for suspected COVID-19 down from 677 to 645. Percentage of people testing positive for COVID-19 citywide down 21% to 20, only a little but still down. Public health lab tests for COVID-19 percentage down 50% to 33%. We keep putting together good days. I want us to put together great days and consistent days, but we're clearly moving in the right direction. Let's stick with it. Let's stick with it because it's working. But job one is to get through this steadily, constantly, and get to the point where we can start to get to normal. But at the same time, job two is always there. Never let that boomerang happen. So avoiding that boomerang, that's up to you, and that's up to all of us here at City Hall to make sure we are prudent and careful in the steps we take. You keep doing your part, and you're doing it great, New York. We'll keep doing our part. We will not let our foot off the gas until we're sure it's time. That's how we keep the boomerang from happening. That's how we move steadily forward together. A few words in Spanish.
You've been listening to Mayor de Blasio give an update on the coronavirus outbreak in New York City. We're now returning to regular programming on CBS 2. For extended local coverage, stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News. We now return to our regular programming.